Last year, from 1st of October, when SHA came into effective fully and NHIF became de facto, we had a meeting with the national government and agreed that the services that we were enjoying from NHIF, the comprehensive cover, will then be covered by Social Health Authority. But this only happened for a few months. The whole part of December and part of this year, our members have been complaining. We've seen doctors who are offering services being detained in the hospitals because the comprehensive component of the Social Health Authority is not working. We complained about this 2 weeks ago, and then it worked for 2 days. We are back here because we have many civil servants, we have many public servants, we have many doctors that as we speak now cannot access both public and private services using Social Health Authority. Yet we have been faithfully paying the medical allowance which we relinquished and the statutory reduction of 2.75%. When we tried to ask Social Health Authority why this is happening, then they said that the employers, which also is government, has not remitted to them the 2.75% that have been deducted. So government deducts the money from the employees and say that they have not remitted to the government, and therefore the government decided not to give services to the workers. So as we had promised earlier, we are not in a begging mission. The access to health care for doctors, for public servants, for civil servants is a right. And the fact that it's not a free service that we are asking for, but it's a service that we are asking based on the finances that we have been deducted. We have resolved, both as KMPDU and as UKCS, that next week on 18th, we'll have a mega demonstration from Kenyatta National Hospital to Social Health Authority to put petition there. And then we proceed to the Ministry of Health, then we proceed to the Ministry of Public Service, and then to Treasury. And then we want to ask the government, both the national government and the county government and Social Health Authority, the ineffectiveness in management of Social Health Authority should not be our problem. The ineffectiveness in running the government is not our business as workers. Ours is to do our jobs as we have trained. And therefore, if there's anything that is interfering with that, we can't allow. Therefore, this time and in this moment, the action that we're calling for on 18th is not only for doctors, it's for all the civil servants. So we're expecting the Huduma centers to be closed. We are expecting those in different offices that are serving different services to be out, because you have to choose whether to be in those offices where you are underappreciated, where you're not valued, or to be in the street to ensure that this money that's being deducted for you, you can access health care and your family can access health care. We have learned time and again that the government do not give in to issues when they're begged. We've learned that it only happens with demonstrations, with protests. And we've also discussed together with the UKCS as KMPDU that if these matters are not resolved, we're not just going to resolve to just demonstrations and protests. We're actually going to issue a strike notice on that 18th and proceed on strike, which will involve all the doctors and all the civil servants. That is what we are demanding, because there is no way we are going to continue begging where the government is very busy deducting money from us, extracting money from us, and they have no any intention to ensure that the Social Health Authority is working. Thank you.